Is the United States healthcare system kind of like a Ponzi scheme? Let's talk about it. So, hi, my name is Angelique. Welcome back to my series on me telling you the top 4 reasons why I left the United States of America to go live in Paris, France. So, first of all, I'm 60 years old, not 16, 60. And healthcare was a big deal. Thank God I'm healthy. But just in case, what if I wasn't? The healthcare system here is kind of sketchy. So, my first question was, why in the hell can other countries all around the world figure out how to give their citizens free, top of the line healthcare, but the United States can't do it? Tell me why. So the UK, healthcare is free. Germany, free. France, it's subsidized, meaning it's subsidized through taxes. So taxpayer dollars go for their healthcare. Right? Go figure. Clever. Spain, free. Italy, subsidized through Social Security. Portugal, free. No wonder everyone's moving there. The Nordics, the Netherlands, subsidized. Canada, free. We all know that. The Asian countries, Thailand, free. Australia, New Zealand, free. United Emirates, free. Tell me why we can't do that here. It's not rocket science. If those other countries all around the world can do it and figure out creative ways to do it, why can't we? I don't understand why it is that we can't have free healthcare here. But remember back in the day when Obama said every American should be entitled to free, top of the line, quality healthcare. So where is it? What happened? So he created Obamacare. Remember that? Obamacare was supposedly going to be more affordable, not as expensive as PPO, but not as cheap as an HMO. You didn't have to go out of network, blah, 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 all that nonsense. But the caveat was, everybody signed up for it, but the caveat was, at the end of the year, if you did not have every member in your family signed up for Obamacare, you would be penalized when you did your taxes $100. So if there's 5 people in your family and only 2 of them had Obamacare, the other 3, $300. Tell me why your Obamacare and the administration was saying that everyone in the United States should have free health care, but then you were like at the back end sneak penalizing them if they still couldn't afford it. If they didn't have health care to begin with, what would make you think that they'd have your $100 to pay for not having Obamacare? Like, make all of this make sense to me. This is one of the reasons. This is the top reason why I left the country. So while we've got people on this app saying, if Trump wins, I'm leaving the United States, leave. Bye. You might as well leave anyway. Doesn't matter who the president is, because the healthcare system is not for us. It's not for us. And then you go to the doctor, you have to pay a copay. If you have to have several procedures and you have to spread them all, over a couple of appointments, another copay every single time. You have 3 cavities, you don't want to do them all in one day. You have 3 appointments, every single time a copay. And what about that big fat deductible that you have to pay before you can have a procedure done? And then when you pay it, the procedure has to still be approved. What are you approving? And why can't I go to a doctor over here? Why do I have to stay in network? Like, what is all of that? Who made all these rules? Not to mention the misdiagnoses did I say that right? Misdiagnoses? I don't think that's the word. When people are diagnosed the wrong thing, you know what I mean? So like, for instance, my daughter had some issue. She went to the doctor. They said she had lupus. My daughter does not have lupus. She had an allergy, an allergic reaction, and she's allergic to gluten. They was ready to put her on all kind of medication for lupus that she does not have, right? So then she would have been on all this medication, and then she would have had to pay for that medication because, you have to go to the doctor, you get the prescription, you go to the pharmacy, you got to pay the copay, blah, blah, blah. Now all that medication has all kind of bullshit side effects. Now you got something else when she was just allergic to gluten. Now she doesn't eat gluten and she's fine. Where in the world besides this country do they do shit like that? Where? So that is the top reason why I left this country. And for all of you people who are saying that you would love to move, but you can't move, I promise you can. I promise you can. Go look at my other video. If you're considering leaving the country, tell me down in the comments why. And tell me, where would you go? I can help you go. I got connections, and you don't have to just go to Paris. And be careful with Portugal, because it's getting all kind of inflated with all the people moving there. So let me know in the comments, what do you think about our healthcare system? Does it resemble a Ponzi scheme to you? And if you wanted to leave the country, why would you leave? And please don't say because of Trump or Kamala Harris, because that we're not talking politics. We're talking healthcare. Thanks for liking and following. Please share this video, and please let me know in the comments, what do you think? Am I crazy, or is our healthcare system shit?